Hello, my name is Dr. Randy Hansbrough. I want to thank you for joining me today in this approximately 45-minute webinar. I know it's a little lengthy, but I believe that you will gain a lot of valuable knowledge from it. And like this webinar, which is imperfect, you don't have to be perfect either, because the system is so efficient that even if you only do half the things right, you're going to benefit from what I have to teach you today. I love helping people overcome their thyroid conditions, getting healthy and feeling great again. So I want you to get fired up about what you're going to learn, because once you feel much, much better, you're going to be able to start fulfilling and pursuing your passions and your dreams again. And I believe that you're going to love the process so much that you'll be spreading the word with your friends and family members, which I appreciate very much for that. So getting your thyroid function and your health back, feeling great again, back to living your life fully and pursuing your goals and dreams with energy and purpose, that is what we are all about here in my clinic. So why would you listen to me? Well, I'm in the trenches in my office every day. I love teaching people about thyroid health. I've done it for a long time. Now, there are a million opinions floating around. So you're probably thinking to yourself, well, why should you pay attention to what I say? And the answer to that is, after many years in practice, I've developed a technique through working with many doctors from all over the country. And actually, I teach other doctors this method, which you're going to learn about today. I'm going to show you the ins and the outs so you can finally get those results you've been looking for. And I'm going to reduce and eliminate these long-term costs and hassles that you've been going through with all the frustration that goes along with it. Okay? Now you'll notice that every several slides you will see a phone number at the bottom, and that's the best way to reach us. Sometimes it'll be a 7701 or a 7707. Either one will reach us, so we can set up a time where you and I can sit down and speak directly, either by Zoom or by telephone or in the office, whatever you prefer. So who is this for? Well, you're in the right place if you just have those mysterious, unexplained health conditions. You feel poorly all the time. You're just confused about it all. Your medications aren't working, and it just, is just a frustrating pain, So get out a pen and paper. Start taking some notes as we go through this together, okay? So why am I different? Well, as I mentioned before, I've collaborated over the last 35 years with the world's best in natural healing. I've traveled the world, mostly the United States, but I've gone throughout Europe and South America, and I've gathered all kinds of information that I am now able to bring to you directly. I've helped thousands of people with thyroid conditions and other autoimmune disorders, and I have been well trained. I'm not bragging, but that's the fact. Multiple certifications, which we will review shortly, in functional medicine and functional neurology. I work with many medical doctors in my local area and from around the state of Florida, getting their patients off of drugs under their supervision. It certainly is my lifelong passion. I've been doing this now, like I say, over 35 years, and I will continue to help people. I have no desire to retire because I love doing what I do, excuse me. And obviously, if you do the same things, you're going to get the same results. If you really want to turn this around, you have to do something different and better. So tell me something if this sounds familiar to you. You have poor quality sleep, no energy, aches and pains around your body, thinning hair, skin inflammation in the form of rashes, rosacea, whatever it is, dry skin, brittle nails, no sex drive, and you can't think very clearly. These are symptoms and more of those who have chronic thyroid conditions. So tell me if your thyroid is kind of ruling your life rather than you having control over the way that you live your life. And if you're like a lot of people with chronic thyroid conditions, you might just want to be left alone. That's very common. You just feel very poorly. the quality and the enjoyment at work. Your zest just isn't there. Your relationships suffer in your marriage, with your children, with your friends, hobbies. You know, if you don't feel well, you probably don't feel like doing them. So a little bit more about me. I am licensed in the state of Florida since 1980 as a doctor of chiropractic medicine, which is all about natural healing. I am a certified functional medicine practitioner. I have trained literally thousands of hours in these fields of neurology, endocrinology, immunology, and other nutritional concepts in healing. I've applied all these concepts for over 35 years, as I've stated, and I also authored a book that is now very popular called Heal Without Drugs. You can see that at healwithoutdrugs.com if you're interested. And now during this presentation, you're going to learn how you can improve all those symptoms that we discussed earlier, stop losing more hair, and actually gain hair in many cases, improve your energy in nearly all cases, getting rid of chronic pain, that's very common, losing weight, keeping it off because you've actually fundamentally changed specific things about your life and the way things are done. Having normal bowel movements again, would that be nice? Sleeping deeply every night and getting back your sex drive, your libido, and basically just finding your passion for life again. Wouldn't that be great? So regaining the function of your thyroid means you reclaim your health. If you reclaim your health, think about it, you reclaim your life. If you reclaim your life, you can then live your purpose. So you ask yourself the most important question about life and living. What do you want to do with your life? I think you're going to want to live your dreams when you feel better. So ask these questions. How would a healthy thyroid and better health overall affect you in your life? Would you have better quality time with your family, with your spouse, with your kids, with your friends, at work, personal time with the hobbies you love to do, and traveling and actually enjoying it? A little bit about me. I mentioned a little earlier, I graduated in 1980 in Life University, Atlanta, Georgia, as a doctor of chiropractic medicine. Moved to Stuart, Florida, been practicing here ever since, 40 years, absolutely love it. But then I realized that there was more to healing and health than straight chiropractic spine treatment. So I went back into an intense study in 1988, became board certified in functional neurology, which is recognized by the National Commission for Certifying Agencies. Now, I'm not bragging, but that should indicate to you how serious I take this. The National Commission for Certifying Agencies is recognized worldwide as the gold standard for physicians who want to become more certified and more specialized in a precise area of medicine. And that's how serious I take my education. I have to recertify every year to maintain that status, the purpose of which is to stay abreast of the latest research findings, which I love to learn about. So I bring that experience, I bring that passion to you when you become a patient of mine. I am also a certified functional medicine practitioner. So the two of them, neurology and medicine, functional neurology and functional medicine, they dovetail together because we're talking about the brain and the nervous system, and we're talking about your biochemistry and how we can improve all of it to improve your life. I traveled over the US and Europe to learn all these things, and it was quite a pursuit. You know, everything that you try doesn't necessarily work. So there were a number of failures in regards to the combinations of nutrients and herbs and other natural ingredients that I put together with the help of other physicians, and the lab tests that we needed to run, and the way that we pull all this together has culminated in a very effective method, which I was at the center of helping to develop. You know, thyroid conditions are well known, but most people really don't understand them, and I suspect that you don't either. Otherwise, you wouldn't be on this webinar today. And that's what makes it so disheartening to see people suffer like that and not get any help. That's what we are all about here at my facility here in Stuart, Florida. And it was a humbling experience to go through all of this trial and error, and a lot of things worked and didn't work. And, you know, you just end up getting frustrated along the way. But eventually we did not quit. I decided I was not going to quit until we found the exact best system out there. So I'm very excited to share this with you, which we're going to get into very, very shortly here. These are tools that you can use right away. These tools that you're going to get for free on this webinar may help you without the need for anything else. A lot of people do find that to be the case. But if you want to have more guidance and more supervision and something where you have a physician like me to help you down that path, then we have a proven roadmap that I've used over and over that works just great. And I do believe it is the missing piece in your thyroid health. You're going to see real proof, not a long period of time either, months, not years, some people even weeks, not months. And so this is the way it goes. Now, I don't want you to feel badly about you maybe feeling responsible for not being as healthy as you'd like, because it really is not your fault. No one has ever shown you what I'm going to show you today. And it's really simple to use when you have a system and a path to follow. And the expense is really very doable for just about anybody if you can afford a cup of Starbucks coffee a day, basically. This is a time-tested and effective approach. Thousands have followed it with great results. When it becomes a part of what you do and how you live your life on a daily basis, I promise you're never going to want to go back. And it's really quite easy to follow when you follow it through my method. Over and over again, we've proven this, that the thyroid relief system that I designed is really quite a great program, if I do say so myself. You can definitely do this. And if you've ever thought, I'll fail because nothing I've ever tried in the past has worked, well, I think today is the day that that ends. So even if you don't reach your ideal thyroid health goal, you're still going to get a ton out of it. You're going to be way ahead of where you are now. And the reason is my program comes from solid referenced science. That's all I base my advice on, science, not guesswork. So I want you to take the opportunity with what we're going to offer here today. Stick with me through this webinar process and you will see what I mean. And at any time you can call that number and schedule if you'd like. Now I'd like to give you this disclaimer because it's required by the FDA that if you are currently under the care of a medical professional, this webinar is not intended to have you go off of any of the medications that your medical doctor, nurse practitioner, or whomever may have prescribed it legally to you. So I'm not going to be giving you any prescription drug recommendations. Also, the FDA has not evaluated the content of this presentation, so it is not to be considered as direct medical advice. Only suggestions that you may wish to take advantage of should you decide you want to give our office a call, okay? We both know that you've been mismanaged. You know it, I know it. Whoever's been giving you advice doesn't have a clue, really, otherwise you wouldn't be here today. The medications are never going to bring you to a point where you are truly healthy and you know it in your deep soul. In fact, your condition will get worse over time unless you do something different, which really is not a medication approach. How much time and money have you wasted on looking for a solution, spinning your wheels, week after week after month after year. I'm sure it gets very frustrating. You're not able to enjoy your life and your loved ones, and you've spent probably a good deal of hard-earned money on things that just don't work, or you've lost money by not being able to work to the level of proficiency and efficiency and productivity that you know that you're capable of. And when you take into account not just the physical and the emotional and the psychological loss by having a chronic condition like a thyroid disorder, but also the way that it impacts you financially, is not a good thing in most instances. So I'm asking you, have you had enough of it? You tired of all those drugs? You tired of all the downward spiral that you've undergone these years? Are you ready for a life-changing experience? Because we're going to get into that very shortly. Let's go. I've got news for you too. Your thyroid condition is not going to just magically go away on its own with or without medication. Over time, it will likely get worse unless something is done to intervene. The good news is you're going to learn about that, and we're going to get to it very, very shortly here. So stay with me. I want to ask you, how would you like a good night's rest every night? How would it feel to have boundless energy and always feel great? What would it do for your relationship, whether married or not, to have a healthy libido, whether you're a man or a woman? If your hair didn't fall out, how would you feel about that? If your weight were closer to normal, do you think that would be a good thing? I'll bet you'll say yes. And what if you could think more clearly and have a better memory? Think about all the ways that this will affect your life when you're doing much better than you're doing now. And this really changes everything. It's information that you're going to be able to use very easily. These are powerful steps that I'll bet you that you've never heard before. It will make a big difference in your life, and it is the key to getting a handle on this whole unfortunate situation that you find yourself in. Now, in our time together today, you're going to learn what it's going to take to get your thyroid under control, why what you've been doing will never work. It hasn't worked before, it's not working now, and it's not going to work in the future if you don't change some things drastically. We're going to learn, I'm going to show you how your thyroid condition developed in the first place, and I'm also going to explain how you can expect to see finally some results you've been looking for a long time. On this journey, I want to take you from feeling terrible to great again, from being worn out to being ready to just go for it in life, to from being slow-minded to quick thinking, from being chubby to leaner and light-footed. And if you have any bowel conditions, to regulate those, whether it's constipation or diarrhea, it's got to be brought under control in order for you to have a healthy existence. So therefore, can I get your agreement that we're going to get through this whole thing together? I promise it's going to be worth if you'll stick with me to the end, please. Now, we're going to get into the 5 keys to feeling great again. This is where we get down to the nitty-gritty. And even if you have a stubborn thyroid conditions and you've been told that your labs are normal, your medications are working, but you still feel lousy, does that make any sense to you? Of course not. We're going to show you why shortly when we reveal this thyroid relief system right away. So this is a foundation for feeling great again. As I said earlier, you're going to experience more energy. You're going to save money on long-term drug costs and money lost from lack of productivity. You're going to lose weight without a struggle. You will have an improved quality of life, and your body will be in much better shape for the long term, not just the short term, but a long term, if you follow the thyroid relief system. You've been told a few things like this. I'll bet you this will sound familiar to you. Well, Mr. Smith, your TSH is too high, so we have to give you more medication. Or your TSH is too low, so we have to lower your dose. your T3 or T4 is too low, you need a higher dose. T3, T4 too high, let's lower the dose. And the one thing we hear the most, your TSH and your T3, T4 thyroid hormones are normal, everything is fine. But you say, well, whether you say it to the doctor or not, I don't really feel well at all. I don't care what your lab tests say. I don't care what you're going to do with the medications, up, down, or in between. I'm not getting any better, and this is no good. So a couple of myths here that we need to check in on, because this is something that most people with thyroid conditions are very confused over. And the myth is this: eventually my doctor will figure out which medication will finally get everything going in the right direction. But the real truth is medications have never cured anything, including thyroid conditions. And as you'll see here shortly, they usually cause more problems. The old way of doing things is basically moving things around, moving symptoms around, manipulating symptoms. That's the disease treatment model. You never find the underlying root cause, and the condition is allowed to worsen over time until you get to a point where you're just miserable, and sometimes require surgery. Now, this is an interesting piece of information I think you'll get something out of. And the thing to keep in mind here is that medical doctors, and I have a number of them who are actually good friends of mine, and we don't agree on everything, but we agree on a number of things, and this is one of the things we do agree on. Medical doctors are trained to prescribe pharmaceuticals, statins for cholesterol, painkillers for joint pain, antacid for acid reflux, laxatives, loperamide for diarrhea, cortisone for skin problems, beta blockers for blood pressure, and all kinds of immunosuppressant drugs for inflammatory diseases. Well, do you want to live like that? Now, as I said earlier, you're going to stay under your medical doctor's supervision while I work with him or her to help make these medications less necessary, because you're doing better, you're healthier, and I think everybody wins when that's the result. These are some of the side effects from prescription medications, and you can find this is exactly where I got it from, online at drugs.com, drugwatch.com, or webmd.com. These are some of the things that people feel who have thyroid symptoms, some of which comes from the medication itself. In the case of SYMPTOM, people develop chest pain, extreme fatigue, a racing heart, heat intolerance like hot flashes, irritability, itchy skin, swelling in the face, tremors, cold and clammy skin. That's just SYMPTOM. Armour thyroid, menstrual changes, appetite loss, diarrhea, trouble sleeping, chest pain, tremors, fever, cramps, nervousness, shortness of breath. Is that enough? How about nature thyroid, vomiting, weight loss, headache, sweating, heartbeat rapid, interruption of sleep, chest pain, fever, or Levoxyl, decreased urine output, dilated veins in the neck, labored breathing, hives or welts, blood pressure increase, pain in the arms, jaw, back, or neck. Really, do you want this? I mean, you're going to have it most likely if you continue down the path of using drugs to try to control your thyroid condition. Now, the statistics on prescription drugs are not so good. Americans represent 5% of the world's population, but yet we consume 75% of all the prescription drugs made worldwide. And the World Health Organization ranks the US at number 37 of all industrialized nations. So the obvious question, all these drugs that are doled out year after year, if they were so good for us, then why aren't we number one in the world, according to the World Health Organization? It just does not make any sense. The new way of doing things, however, rooting out the underlying cause of your thyroid dysfunction, is truly like the sun rising on a beautiful day. There are several elements to this. We want to improve upon the way that your digestive system works, because that's where all the nutrients come from, and that's how you eliminate waste. So for those of you with gut disorders and constipation or diarrhea, that's a very important thing for you to get that under control. We want to get your hormones balanced as best they are capable of for your gender and your age, because it's going to differ from person to person at that person's age and their gender. We want to figure out what that is and what we can do to help you balance it as best we can. Your brain and your nervous system, well, the pituitary gland sits in the middle of your brain and it regulates your thyroid. So if your brain is not balanced with regard to its neurochemistry, how can we expect the pituitary to work properly? It can't. And then there are genetics. You can't control those genetics, but we can do things to improve the functioning of the genetics with customized nutrition matched to your unique DNA code. We can do something better than you've ever done before. 5 keys that you're going to need to know here, therefore, is ideal nutrition, gut health, brain health, hormone balance, and genetic support. Now, not everyone needs all of those types of investigative laboratory tests, but some need them all. That's the purpose of a consultation, where we can get together and talk about all this so you can start feeling really great again. Facts about thyroid conditions that you may not know. 90% of all thyroid conditions are caused when your immune system attacks your body, especially attacking your thyroid gland. Your own antibodies can attack you anywhere and affect all kinds of parts of your body, which account for all those varied symptoms that are different from person to person. And the bottom line here is that we've got to figure out why your immune system is doing such a thing and attacking you, so we can begin to calm it down and your body can begin to heal. So, you don't know these things, and therefore it's not your fault. And the reason why you don't know is we, as Americans, we grow up surrounded by all of these advertisements promoting fast foods that are unhealthy foods, and we just sort of swallow it hook, line, and sinker and give in to the advertisements and eat poor quality food. And a lot of it is loaded with glyphosate, which is a weed killer they spray on the crops, especially wheat and corn and other crops, so that they get a higher crop yield, but that ends up in our food and it ends up poisoning our bodies. Also, these processed foods have flavor enhancers and preservatives, and they don't really have the nutrients that our grandparents used to have, or even our parents. Over time, they make you worse and worse and worse. So some things have to change there with regard to the way that you eat. And that's why I say it all starts with your ideal nutrition. So key number 1, now we're going to be getting into the nitty-gritty of this webinar, is this. You don't know what your ideal foods are. We don't know that until we run a blood test. When we run the blood test, we get to see all types of things: genetics, blood type, immune system antibodies, and we can get really clear and precise with which foods your body wants you to eat and which foods your body does not want you to eat. We can identify these foods on a scale of 2 to 100 and figure out which ones are really severe and which ones are mild. And then we can manage these foods very efficiently with a test that is unique to you and you only. We've been doing this for a long time. It works very, very well. From that test, we can guide you with regard to your perfect meals, the perfect way to eat. Excuse me. This will allow you to lose bloat and weight, have more comfortable and predictable bowel movements, improve with regard to acid reflux, aches and pains improving, energy getting better, skin tone, hair loss, etc., etc. Some things that you can avoid right off the bat. This has to do with what I mentioned earlier, where there are things you can take away from this webinar that you can use immediately in your life to improve the way you feel. So these are some foods that I would like you to consider avoiding. Gluten. Gluten is contained in products that are made from grain, for the most part wheat, barley, and rye, but other grains as well, or similar chemicals like gluten in grains that are not wheat, barley, or rye. So we're going to be talking about that a little bit more later. In regards to dairy products, dairy is really not a natural food for humans. If you observe nature, the animal will only drink milk from the mother of its own species. That's really the bottom line. And humans are the only ones who insist upon consuming dairy. So it's another highly inflammatory food, and it can and has led to breast and prostate cancer in a number of studies, as grain products have done. Soy is mostly now genetically modified, contains that glyphosate weed killer and a lot of estrogen, so I recommend avoiding that. And of course, there's the well-known refined sugar problem, which doesn't exist in nature. It's a man-made product, and it causes all kinds of trouble that can lead to diabetes, fueling cancer, and producing quite a bit of inflammation throughout the body. These are the kinds of foods that you will find these ingredients in: breakfast cereals, bread, pasta, crackers, cookies, pie crusts, pizza, pasta, oh, I said that, sorry, sauces and soups thickened with flour. Then there's cow's milk, butter, cheeses, sour cream, coffee cream, cottage cheese, whey protein, and then, of course, things from soybeans, soy sauce, miso, tofu, edamame, soy milk, and tempeh. Refined sugars, we know, are candies, cookies, cakes, pastries, sodas, and even the artificial flavors are chemicals that you want to avoid if you really want to get your body cleaner and feel better. And I put this little note on the bottom of the slide. Not to worry, there's plenty of good, wholesome food to eat that tastes great. So don't worry about that part. So I want you to stay calm and follow this proven method, because your gut and your immune system, when you get it under control and working to your advantage, should be your friend, not your enemy. And now we're going to talk about that. Inflammation primarily begins in the gut. Now your gut makes up 80% of your immune system. So if you don't have your gut working right, your immune system can't, and your immune system internally gets very agitated and sensitive and out of control. So we need to get the gut under control. The major way for your body to eliminate waste is through your gut, bowel movements. And of course, you're not going to absorb any good nutrients without healthy gut function and digestive function. And it's a barrier between whatever you eat and your bloodstream. So when we don't have a healthy barrier, you'll see shortly how that can be a problem for your overall health. And in order for your gut to be healthy, it has to contain a large volume of what we call beneficial bacteria or friendly bacteria. So we measure that and see exactly what you have in your gut. The origin of inflammation with the gut problem and the intestinal function as a result is referred to as leaky gut syndrome, a permeable membrane. It can also be low enzymes, weak bile from a dysfunctional gallbladder, pH alterations, usually it's too acidic. You could have parasites. You could have low counts of that good bacteria I mentioned. You could have a high bloom of yeast. And then also the foods and preservatives and flavor enhancers and all the chemistry in processed foods can be a real problem for the gut as well. Now, some science that you may not be aware of, and I'm big on science, so I want to share this with you. Inflammation is the root of nearly all chronic disease, even cancer. And that's been known since before 2006, when the article was written and published in Molecular Cancer Research. Inflammation drives a lot of cancers. MIT said that only 5 years ago. The New England Journal of Medicine, way back in 1999, talked about inflammatory heart disease. The Mayo Clinic spoke about it 5 years ago in its relation to inflammatory bowel disease and Crohn's disease, IBS. The American College of Rheumatology discussed this with respect to rheumatoid and osteoarthritis. They've been talking about that a long, long time. The National Academy of Sciences 6 years ago discussed the concept of skin disease as inflammatory. And many chronic diseases were discussed by the British Journal of Nutrition fairly recently. So you get the idea, if we don't get inflammation under control, which begins in your gut, then you really don't stand much of a chance to get your thyroid inflammation under control either. Now, when you don't have good gut function, the food particles cannot be digested properly, and they ultimately pass on to your liver because everything you eat goes to your liver ultimately. But if these particles are too large, it's going to clog up your liver, and that's where a lot of bloating comes from and weight gain around the abdomen. But on top of that, your liver will not be able to convert cholesterol into pregnenolone. Therefore, you'll have low hormones typically. Your red blood cells are not going to be converted into bile for the gallbladder, which is attached to your liver, so you can have weak bile. And that makes it very hard for your body to absorb vitamins A, D, E, and K, which are critical for many functions in the body. There will be less toxicity being removed from your body, and therefore you'll store more of that toxicity in the form of fat, making it harder to lose weight. And then, specifically related to your thyroid, your liver will not be able to convert an amino acid called L-tyrosine into thyroxine, which is T4, and T4 will be low, most likely, and that'll lead to your thyroid hormone issues. So having your liver healthy is very important for your thyroid. Now, I mentioned earlier that the liver can become bloated and swollen from this leaky gut, and then you can develop leaky liver. When that occurs and the liver is dysfunctional and your bloodstream biochemistry goes out of balance, cholesterol often increases, which puts you at greater risk for heart disease. Blood sugar often increases, which puts you at greater risk for diabetes. T4 is low, as just discussed, so that now you're at greater risk for hypothyroidism. Blood toxicity rises, so now weight goes on, and your hormones being lowered from a lack of pregnenolone leads you to fatigue, low libido, poor sleep, and a whole host of other issues I'm sure you could do without. So the inflammation in the immune system occurs basically where the antibodies are fighting off these undigested food particles because your immune system is trying to defend you, and it sees these undigested food particles floating around the bloodstream, so it starts to attack them with antibodies. And that's where the beginnings of autoimmunity comes from 90% of the time, is from undigested food particles and immune system response. And that's where most of these thyroid conditions come from as well. When these antibodies explode and release their inflammatory chemicals called cytokines, they dissolve those food particles, but they also start damaging your own cells. And that's why aging will accelerate as a result. Now, don't forget, if you took out a piece of pen and paper, there's a phone number once in a while on these slides you can write down and call us when you're ready, okay? So the solution is to help your liver and your gut repair itself. So we've prepared these good tasting products that will gently clean out your liver and help to repair the intestines, resulting in improved liver and gut function and performance, which begins to decrease the process of inflammation throughout the body, bring down the toxicity levels, help make it easier to lose weight, help to improve cholesterol levels and sugar reduction and hormone improvement. And this is all part of the thyroid relief system when we also utilize lab testing to make the process much more accurate. Key number 3, your thyroid hormones are critical for your body to be balanced. So, but it's not only your thyroid hormones, because those are dependent on other hormones. It's a family of hormones that affect one another. They have to be measured and supported naturally using your nutrients your body must have. And we do that with saliva testing. So the first test we do, as mentioned earlier, is blood, so we can identify which foods are your friends and which ones are your enemies and get you on the right dietary path. The second the second test we do is a stool test, and we can measure, how your gut is functioning and how we can improve upon that. The third test is a saliva test, and we can do a very accurate measurement of your hormones with saliva. We can measure thyroid stimulating hormones, thyroxine, T3. We can measure insulin, leptin, cortisol, DHEA for blood sugar, for energy, and for sex hormones. So all key hormones work together to help the thyroid. They must be measured for best results. The body must be precisely nourished in order to repair itself. And the saliva testing gives us that information much better than blood does. So why not consider moving your hormones toward a better state of function and balance? Key number 4, your brain. Everyone knows your brain is your body's master control system. And I mentioned earlier, it's because the pituitary sits in the middle of your brain that if we have balanced neurotransmitter biochemistry in the brain, well, your pituitary can function better and better control the thyroid gland by correct levels of TSH. So therefore, a healthy brain equals a healthier thyroid and body. Now, these neurotransmitters and hormones kind of go together, and many scientists today refer to them as neurohormones instead of separate things that function independently from one another. You've probably heard of some of them: serotonin, melatonin, dopamine, and GABA, but there are many others, and they do many things. But the point being that when your brain and your whole body is out of balance, havoc will occur internally. And we need to know that a healthy gut makes 80% of the brain's neurotransmitters. That's why we pull all of these tests together to give us the valuable information that we need. So testing for these healthy brain chemistry components called neurotransmitters are key to a healthy brain. Research has shown we can measure that in the urine, and it's very accurate to determine the brain levels. From that, we can give you precise nutrient support, precise botanical support, plant and herbs, resulting in improved neurotransmitter levels in the brain. So we want to nourish your brain with what it needs, but first we have to measure what it needs by measuring your neurotransmitters. Then finally, key number 5 is your DNA. Now, nobody has perfect genes. Genetic mutations are very common, and they affect the thyroid, the immune system, gut, heart, kidney, brain, and other central functions. Nourishing with precision supports those DNA functions. So therefore, providing what your genetics will thrive on gives you better health. Inflammatory foods put your body in stress. And when we get all this on the right track, you'll feel a lot better. Now, you're born with whatever you've got, so the DNA is not your fault, right? But we have a new science called epigenetics, where we can test your DNA with pinpoint accuracy. In order to test your DNA, we do a simple cheek swab. The genetics will then take the cells from the inside of your cheek and analyze your DNA. Then they will determine exactly what you need in the form of a nutritional supplement, which will be the right combination just for you of vitamins, minerals, amino acids, proteins, and botanicals, and put in the right mixture into capsules with the right ratios of these various ingredients. And these unique customized supplements can be shipped directly to you. That's part of the thyroid relief system, and it is state-of-the-art, cutting-edge science. Now, it may not be the only thing that you need, or you may need other things and not need this. I don't really know that until I meet with you and have a good, thorough consultation with you. So I want to ask you what your why is. There's a picture here of an attractive young family. What is your why? Why are you living? Is it to benefit yourself, your family, your friends, or all of them? Is it to pursue your passions and your dreams and your goals? I would say the answer to all of those questions is a resounding yes. Well, do you think you'll be able to do those things better when you're healthier? That is your why. So why you showed up here? You want to be stronger again with a healthier thyroid, I'm assuming. You want to have all the benefits of feeling great again. You want to know how this program can literally change everything for you and finally get rid of the chronic thyroid symptoms. Let me ask you this, are you worried about your willpower? Have you tried things before that didn't work? Maybe you're thinking, I always eat things that I shouldn't. I give in to my cravings. Something is holding me back and I don't know what it is. When you diet, you end up overeating anyway. Yeah, a diet is not really what this is all about. If you give up, how will this affect you in 1 or 2 years? Ask yourself that question. I assure you it's not going to be good. And what would the message be to those around you, and especially your children who look up to you? So therefore, ask yourself, can you do this? Can you do this? Well, you absolutely can. Many others have done this before you have. So I'm going to challenge you to remember these 5 keys because they're going to be life-changing for you. If we discover what your ideal foods are and you follow that based on a blood test, if we discover what to do to repair your liver and your gut, a stool test, if we discover how to balance your hormone with a saliva test, if we discover how to balance your neurotransmitters in your brain with a urine test, and if necessary, if we discover what your DNA test is and how to customize nutrients for you, do you think this is going to make a difference in your life? I guarantee you it will. So just imagine, with no more wasted time, what would your life look like? Being full of energy, having refreshing sleep every night, no more aches and pains, having a well-functioning brain again, having a normal weight once again, and having it permanently, having normal digestive and bowel function. Do you think you're going to be happier and more upbeat? I think the answer is clear. Doesn't that sound good to you? So if you've tried everything and failed, you're definitely not alone. That's why I want you to think differently. You'll succeed if you don't give up. If you knew exactly what would work, would you give it a try? And then ask, when do you want to start your new life? And I got to tell you, there's no time that's better than now. I want you to listen to some of my clients or patients, whatever you want to call them. These are just a very few of them of many, many that would take way too long to share with you, but read what Laura has to say. Read what Cheryl has to say. How about Trudy? When she went back to her medical doctor who told her she didn't need her medications anymore. How about these people? Kim. She's no longer depressed. She has energy. Her stomach feels better. Or Lori. No more brain fog. Energy bounded. 20 pounds of weight loss pretty much effortlessly. Or Linda, and how her marriage is doing much better, among other things. I said something at the very beginning of this webinar, and that was, the webinar is not perfect because I'm not a public speaker, but we're getting through this all right. And even if you only did half of this correctly, you're still going to get good results. But imagine if you followed it to a T, what you can achieve for yourself. And it's right here in front of you. And by the way, it isn't that expensive either. The price of a Starbucks coffee per day, who can't afford that? Especially when you get rid of some of the unhealthy foods or other unhealthy habits that have brought you to the point where you are today. It's a lot to absorb. I know that. We've gone through a lot. You've hung in there with me for a long time, and I really appreciate that. Figuring out your ideal foods, cleaning your liver, repairing your gut, balancing your hormones, getting your brain balanced with nutrients, taking the right supplements for your DNA, whatever it is that we determine that you need after a consultation, I will guide you every step of the way. All you have to do is call us and set up that appointment. More testimonials. Sandra. We clicked immediately because I listened to her. You need to be listened to. That's something doctors often don't do. Listening. Marilyn and Chris said the same thing. I'm a good listener. If I do my part, you do your part, we're going to succeed together. Enjoy your work more. Have more beneficial and satisfying relationships. You want to get back to your hobbies, basically feeling great again. I will guide you there. I have something more for you. Meet with me over the phone. We will go over your health challenges. Now, this is a seminar that I don't take lightly for those who take the time to come all the way through to the end. We fill up pretty quickly with our appointments, so if you feel like you want to get on the phone and discuss this with me, the consultation is free. You could come in as well and meet me in person. That's fine too. That consultation is free. Either way, I would want to look at your lab tests. We have to do this in a HIPAA-compliant, legal, privacy-protected way. So we do that. We set all that up for you when you call us. All right? So I will look forward to that. But I do not accept everyone into my program. You must be 100% committed. If you are, you'll get good results. The average weight loss is 30 pounds with improvement in sleep, energy, pain, sex drive, skin and hair, brain clear, and much more. If, after our consultation, I think we're a good fit, and I am sufficiently convinced that you'll follow my guidance, then I may invite you into my program. So we shall see when we talk. All you have to do is schedule this free consultation, and you can experience what Genevieve experienced as well, and we will take it from there. Something that I believe you will not regret. You have two choices, basically. You can continue to do it slowly on your own, or you can do it a lot faster if you allow me to guide you step by step through the process that I've created. So go ahead, schedule now. Call us at 772-287-7701, and I very much look forward to meeting you soon. It would be an honor to help you. Thank you for allowing me to present my thyroid relief system, and I trust we will be talking very soon. Thanks so much.